Welcome to adaptnclex. Thank you for clicking on this video. With the NCLEX, content is great. You need your content to be able to pass the test. But then in addition to the content, you have to have some strategy to approach these questions. And so today my aim is to show you how to answer questions. We rated which of the following instruction the nurse should provide. So I'm looking for an instructional teaching that I need to provide to the patient. That's my ask. Then what is the case? A client was diagnosed with active TB. Patient was placed on isoniazid, entabutor, rifampin, and streptomycin. Which of the following instruction the nurse should provide? Therefore, in my case, I'm dealing with some patient in the hospital who is about to leave after active TB. So hospital, we are in a clinic. So what are our pathways? TB medication, which include isoniazid, etobitor, rifampin, and streptomycin, in addition to active disease. So we have active disease. What will be our rewrite? Somebody who has active TB now on 4 medication and is about to go home. Straightforward. So we're going to use that term, that information in our rewrite to analyze each question. We don't compare each other question. We just using that information to answer one of the question answers as much as possible. So take vitamin B6. Then you look at your keywords. Active TB, 4 medication, and instruction. Why would you tell the patient to take vitamin B6? Then you remember isoniazid. You need to take B6 to prevent peripheral neuropathy. So that is the main reason why that teaching should be given to the patient. Move on to the second one. You don't overguess yourself. You already know the answer. Expect orange yellow color of your urine. Then you ask yourself, why should that happen? You look at your pathways, TB, active, 4 medication. Well, one of the medications is rifampin. You tell patients that any body secretion is going to change into orange yellow color. So they shouldn't worry about it. And this is consistent with being on rifampin. Therefore, this teaching is provided. This teaching is provided. Ophthalmology appointment as scheduled. Then you evaluate the 3. What do you have with the 3 pathways? You're just using everything in the pathways. TB medication, active. Which one of them? Why would I have to see ophthalmology? I just have TB, where entabutor will cause optic neuritis. So therefore, that patient need to see ophthalmology so that that will prevent the problem. If it's going to happen, they can catch it as early as possible. That's the reason why they need to see ophthalmology. So this teaching is effective. Drink a lot of water. Why do I need to drink a lot of water? Then you look at it and say, streptomycin is aminoglycoside. Therefore, it affects your kidney and your hearing. So nephrotoxicity and ototoxicity. Therefore, this is good. I need to drink a lot of water to prevent kidney injury. Call with ringing in the ear. This is consistent with the streptomycin. So that's good. That's tendinitis, early sign. Remember, this medication, when it causes hearing problem, this is permanent. So you want to prevent it as much as possible. No contact lens for now. Like I said, these patients, every secretion will be orange-yellow because they are on rifampin. Therefore, if they wear contact lens, you tell them to take it out and have a prescription. After they finish the medication, which will last between 6 to 9 months, they can put a contact back on. So this is also good. I intentionally wrote this question so that I can give you pharmacology, medication, pharmacology. You covered everything you know about pharmacology, for active TV. So this is how you answer based on the technique I provided. So let's clean this and then move forward and see. So same thing, we have the same SATA question. We're going to use the same strategy. So it's a SATA question. We read the last portion of the question. Which of the following require intervention by the nurse at discharge? So a patient is going to be discharged and need intervention. I have to intervene. They say something or I don't like something that they say or they did. I have to intervene. What is the case? A client with newly diagnosed AFib was prescribed warfarin. Which of the following require intervention? So I have that situation. I'm in the hospital. He has AFib, is about to leave. So my buzzwords is AFib, intervention, and warfarin. These three, try to get 3, 4 buzzwords. So AFib, warfarin, intervention, and discharge. Then you ask yourself, okay, patient now has AFib, is on warfarin, is about to go home. What should the patient does that I will have to intervene? So you read each question, evaluate with your buzzwords. I will increase my vitamin K intake to avoid bleeding. This is a very important teaching you have to let the patient know. When they take Coumadin affects factor 2, factor 7, factor 9, and 10. These are vitamin K dependent factors. This is what Coumadin make them ineffective so that it can ensure its anticoagulation effect. Therefore, you tell patients not to increase or decrease their vitamin K. They need to consume the same amount of vitamin K they were consuming before, so that when there is more bleeding or there is clot, you know that the Coumadin was not working because your dose may be too low or too high. So it is very important you tell the patient, please don't increase the amount of vitamin K you taking now. Continue to take what you were taking before. So if you're taking 20 grams a day, keep on taking 20 grams a day so that I can know that if you're having side effect from Coumadin, then I can stop it. So this is a good teaching you have the patient know. So they should not increase. So this is something you have to intervene. So I'll put check mark, I got to intervene. I will need frequent blood draw. Yes, Coumadin, you got to check their INR and PT weekly. So this does not need intervention. I will continue to take Motrin for any knee pain. They are on Coumadin, so bleeding risk is high. Therefore, you should prevent any bleeding risks. Motrin is not acceptable, so you got to intervene. I cannot wait to play in the football game in 2 days. Well, one of the teaching you give these people is to avoid contact sports as much as possible. You just being on Coumadin, you're going to bleed so that when you have trauma to your head, there's a problem. Therefore, you need to intervene. I will buy alert bracelet on my way home. This is very important because they're taking high maintenance medication. If they bump their head, involving an accident, their bleeding risk is very high. They may have head injury. So you tell these patients to have some identifier in the system so that everybody will know that this patient is taking something that is not good. Therefore, this is not I don't need to intervene on that. So intervene in 1, intervene in 3, and intervene in 4. So those are our answers. So this is another one. This is a prioritization question. So for prioritization question, you have to use the BESHARP method. And check my other videos, you see BESHARP. This is just a toolbox that contains a bunch of tools. which are versatile to use to fix problems. So when patient is having medical problems, you go in and say, what kind of symptoms you're having, what kind of condition you're having. This is the tool I have to fix it. So B, we're talking about breathing problem. E, electrolyte abnormality. S, patient is in shock or is in sepsis. H, hypothermia or hypothermia or hypoglycemia. And A, airway. Okay, R is the neurological problem like lethargy, seizure, or any other thing. And pain is pain that causes you to lose your limb, eyesight, and life. So those are the things. So we're going to see what is going on. See, the same thing, the same situation. What is our ask? Which of the following require immediate attention? So our ask that's the ask is intervention. Okay, you got to intervene. And then what is our case? Okay, a client with hypertension was prescribed losartan due to what? Cough on lisinopril. Therefore, we have a case. We know the situation. Patient prescribed as outpatient with losartan because he was on lisinopril and was coughing. So then our buzzwords is what? We have losartan, okay, and intervention. That's all. Is on losartan. What would you see that you got to intervene? That's all. All these three lines of sentences have converted it to losartan. Something is wrong. I need to intervene. Therefore, for to be sharp, you have to look for something that is bad and is going to kill the patient, or is going to cause morbidity or mortality to the patient. Therefore, systolic blood pressure of 140. The patient is hypertensive, so why do I have to worry about it? No. Potassium of 4.5. I know losartan. Then you go back to your content. Losartan is an ARB. You have to know this medication. Losartan and ACE inhibitor, lisinopril, they have very common side effect. Okay, ACE inhibitor, losartan causes high potassium to be high, hyperkalemia. Okay, and they are teratogens. ACE inhibitor do the same thing in addition to cough and angioedema. There's a reason because they lead to accumulation of bradykinin. That's why it's a problem. So if a potassium is 4.5, it's normal. I'm not going to worry about it. Even though it can go up right now, it's normal. So I'm not worried about it. It's not that low either. So a positive hemoglobin HCG. Then you ask yourself, somebody is pregnant. Then you go back to your case. What do you have? And your keywords, well, I have to intervene. I know losartan causes is a teratogen. So you worry about this. If the patient is pregnant, the losartan causes renal agenesis, so the kidney may not grow. So pregnant ladies should not take ACE inhibitor or ARB. Therefore, I need to intervene. A non-productive cough. Well, even though this is a little bit more worrisome, losartan doesn't cause that. It's the lisinopril that does that because it's an ACE inhibitor. So losartan don't, even though it's an ARB, which has the same mechanism, almost the same as lisinopril, they don't cause cough and angioedema because they don't block the production of angiotensin 2 and then bradykinin. You have to check my pharmacology detail lectures. I have a video on that. But the only thing you have to know, it does not satisfy our buzzwords. Okay, losartan doesn't cause cough. Therefore, why will patient have non-productive cough? I have to worry about it. You have to answer the question being asked. Losartan, it doesn't cause cough. Therefore, number 3 is the right answer. Positive pregnancy test is not good. Similar question. Which of the following need to be reported to the ACP? So that's my ask. You got to report something to ACP. A client with newly diagnosed ulcerative colitis was prescribed adalimumab in the hospital. Which of the following I need to report? Then you say, so in the case we have somebody with ulcerative colitis, UC in the hospital. Okay, something that I'm worried about, I need to report it to the ACP. What are the buzzwords? It's the same thing. Ulcerative colitis. Okay, I have ulcerative colitis is on a new medication, adalimumab. The best way to remember this medication is they all have MAB at the end. MAB. When you see a medication that have MAB at the end, it's immunosuppressive medication. So, or immunomodulator. So patient is on immunomodulator, is a UC patient. Which of the following, when I see, I'm going to call the doctor. That's all, 2 statements. UC, adalimumab, I need to intervene. Simplify the question. UC, adalimumab, and I need to intervene. Okay, then I'll tell myself, adalimumab, or this is the same as Humira, it makes me immunocompromised. Therefore, anything that is related to that is mostly infection. If you make you immunocompromised, your teaching should be infection related. Therefore, all my answers is going to be infection related. There's no other thing. Okay? So, white count of 16. This is tricky. Patient has UC, right? And he came in with ulcerative colitis. This is consistent with having ulcerative colitis, because even though it's white kind of sex, that is consistent. I don't need to worry too much about it. You have to be sharp. Hemoglobin of 10. Ulcerative colitis, they have bloody bowel movement. Was just admitted with exacerbation. So I'm expecting the hemoglobin to be low. They live in a low hemoglobin. They're always anemic. So you don't expect their hemoglobin to be normal. Even though this is 10, that is where they live, is good for them. So thus, I don't need to intervene. Positive PPD. This is a problem. Okay. This positive PPD means what? Latent TB. That means the patient is being exposed before. It doesn't mean the patient has an active infection. But the caveat is when you are immunocompromised, latent TB will turn into active TB. This is why patients who have HIV/AIDS and the PPD positive, when they get their disease get really bad, they become active tuberculosis because they're so immunocompromised that now the latent TB will wake up. The reason why we have a latent TB, your body put it under suppression. So if you put them on immunosuppression and they are PPD positive, you need to stop it. So that's why patients with UC, when you give them this medication, the MABs, you got to check it before you give it to them. Therefore, this I need to worry about. Albumin is 3.0. It's too low for me. Guess what? It's not being sharp. You expect them. They are more nourished. They have leukocytosis and they are anemic. That is unexpected finding. The most dangerous thing for UC patient is being immunosuppressed. And therefore, this is the answer. So this is a very good question I intentionally put there to see how you do the analysis. You have multiple abnormal lab value, but you got to be sharp, not being expected. So our answer is number 3. So I have I said this question just to trick you guys to think you have this question. It look like SATA, but is a multiple prioritization and SATA together. You can put it together. You've seen these questions before. So the same thing is a SATA. You do your ask, case, and because we only have one sentence, then we have to use all of them. Which of the following treatment the nurse should question? So something is happening, I need to question, and I have to make sure the doctor is doing the right thing. So what is going on? A client with jaundice prescribed acetaminophen. Then you put your thinking hat on and said, if you join this, what? Your liver is in trouble. If your liver is in trouble, don't take any medication that will make your liver is in trouble. Acetaminophen and the liver don't go well. This will it will cause more injury to your liver. Therefore, I need to intervene. A client on theophylline prescribes ciprofloxacin for UTI. What is the connection? Theophylline is medication for asthma. Okay, this is for maintenance, and but it's very dangerous medication. It has a very narrow therapeutic um, value basically, and therefore you got to check lab frequently. Um, because of that, there's certain things you have to tell the patient to avoid. There's things that will make theophylline toxicity high. And these are the way I remember them. And 3C and 2A for theophylline. The 3C, one of them is the first one is ciprofloxacin. So they cannot take ciprofloxacin like that. Any medication, antibiotic, you cannot use this medication for that. The second one is cimetidine. So they cannot take cimetidine. Okay, so let me just clean this. I can cimetidine. So I'll just write this here. So first, they cannot take Cipro. They cannot take cimetidine. And the last C is caffeine. This is very, very important. They cannot take this medication at all completely. You can't take them. So you can drink caffeine, you can drink, you can take cimetidine, you cannot take Cipro. The two A's, okay, is related to the liver. The number one cause of a complication from theophylline is liver injury. And because of that, you tell them not to take anything that will affect the liver. So the two A's, the most common one is alcohol. Okay, they cannot take alcohol. No alcohol and acetaminophen. So those are the way to remember all the side effects of theophylline. So no Cipro, no cimetidine, no caffeine, and no alcohol, and no acetaminophen because it causes liver injury. So you can say 4C's basically Cipro, cimetidine, caffeine, and cirrhosis of the liver. But they don't develop cirrhosis, just it causes liver injury. That's why I did not make it 4C. Therefore, because of this, you have to thus we have to intervene, thus we have to intervene. A client on lisinopril with potassium 5.5. We already talked about lisinopril. Lisinopril increases the potassium. Therefore, patient potassium 5.5 is almost high. We got to intervene. This will go up to 6 and patient will get into trouble. A client with asthma prescribed with atenolol for hypertension. Then you ask yourself, why will I worry about this? Atenolol is a blocker. Okay, but asthma patient, you don't need to use beta blocking them because they have receptors. So we have B1 receptor on your heart because you have one heart, and then on the lung there's B2 receptor. Okay, because you have two lungs. If you give them a beta blocker, it can bind to B1, B2. If you give a asthma patient a beta blocker, it can cause bronchoconstriction, and that will be bad. So why is the patient on atenolol? Yes, he can be on atenolol. This is a tricky one. You need to give them something we call selective beta blocker. Selective beta blocker means it block only B1. It doesn't block B2. Those that block B2 will not be good for asthma patient. And then BAM, I call them BAM. So BAM is biso. So we start with the bisoprostol. So bisoprostol, that's one. Then the other one is atenolol. And the last one is metoprolol. So remember them, these three: bisoprolol, atenolol, and metoprolol. Those ones, asthma patient can take it because they are selective beta blockers. They are non-selective. The non-selective one is Enderol and propanolol. So when you see propanolol as a choice, yes, but atenolol, bisoprolol, and then metoprolol, no, that is not bad. So this is okay. A client with angle glaucoma prescribed Benadryl. So yeah, this is very interesting. So for glaucoma, you should avoid anticholinergic. You should avoid antihistamines. Okay, and you should avoid decongestants. These medication all causes dilation of the pupil and worsen glaucoma. Benadryl is an antihistamine, and therefore this is negative. We can do that. So we have to intervene here. A client on heparin with a platelet of 1,000. You ask yourself, what is the relationship between heparin and then platelet? Well, heparin lowers the platelet, and that is what we call heat. Heparin-induced thrombocytopenia. Therefore, this case, if the normal level is to be 150,000 and 400,000, this is too low. You should stop all heparin. Stop all heparin medication. No more heparin inhibitors. So this one, we got to intervene. So 1, 2, 3, 4, 5, we have to intervene. The only person we don't have to intervene is the asthma patient. And then finally, we get our favorites. Who do we see first? The same thing. Who do you see? You got to be sharp when you're seeing this patient. Who do you see? A CHF patient with a BMP of what? 200. What is the problem? BMP of 200. Do I have to worry about this patient? It's in CHF. I know about it. BMP of 200. Okay. What is the definition of CHF? Is BMP greater than 100? That's the definition. So BMP greater than 100 is definition of CHF. And what is BMP? This is the hormones that are released at the wall of the heart, okay, the atrium, as they stretches and they release it to tell you that patient is fluid overloaded. So this is not bad, even though patient has CHF. It just tell me that they are in CHF. There's no exacerbation. There's no pulmonary edema. It does not tell me any symptoms of the patient. That's all. So I'm not worried about it. A client on atorvastatin with glucose of that 200. The best way to remember the side effect of atorvastatin is HMG CoA reductase inhibitor. That's the name of the enzyme that they block to decrease your cholesterol, statins. And the side effect is on it. H is basically a hepatic injury, so hepatotoxicity. M is myopathy, make the muscle weak and then destroy the muscle pain. They have muscle pain. G is your glucose. The glucose go up or they have GI symptoms, nausea, vomiting. The C is the same thing as basically is the enzyme that is broken down when your muscle die. That is CPK. And then A is you cannot use it in pregnancy, so avoid in pregnancy. R is rhabdomyolysis, is connected to the CPK, and the myopathy. And I is glucose increasing. Therefore, this is an expected finding. But in this, to be sharp, you have to connect M to R. That means myopathy is bad. You get a CPK high, and CPK is high, you get rhabdomyolysis, which is then they develop pain. So myopathy They will have pain. This is pain that is affecting your life, limb, and eyesight. So anybody on starting that as muscle pain is not just a pain. This pain is serious. You should do something about it. If the CPK is high, usually if it's greater than 5,000, you have to be sharp. And if they have Rablo, you have to be sharp. Therefore, this, I'm not going to be sharp over it. A client on dicyclomine complain of dry mouth. Then you ask yourself, what is dicyclomine? This is an anticholinergic. What are the side effects of anticholinergic? Dry mouth. What is that? Constipation, urinary retention. Dry mouth, I'm not going to worry about you. You can take sugar-free candy. That's fine. But if this patient has glaucoma and you give them dicyclomine, I'm going to be mad at you. The patient will be mad at you because that's not good. Anticholinergic in glaucoma is bad. But for a dry mouth, yeah, common side effect. I'm not worried about it. A client on clozapine complain of runny nose. Well, then you ask yourself, what is clozapine? Clozapine is an antipsychotic. It's one of the antipsychotic medication. Um, what is the major side effect? It causes agranulocytosis, so it decreases your white count. Okay, any decreased white count will make you risk for infection, so high risk for infection. Okay, risk of infection. These people, the early signs of infection is your priority. URI symptoms, diarrhea, and runny nose. Yes, don't take it just like that. That patient needs to be seen right away. So this is a priority. You are being sharp. This will lead to the S in the BESHARP. This is sepsis. A client prescribed oxycodone now with constipation. What is oxycodone? It's an opiate. What are the major side effects of opiate? You have constipation, okay, orthostatic hypotension, and respiratory depression. Which one should you worry about in terms of being sharp? Well, respiratory depression. I don't, we don't, you shouldn't worry too much about constipation. You shouldn't worry too much about orthostatic hypotension. Number one problem you should worry about is respiratory depression, which is in the B sharp. That is the breathing problem. So if these people on oxycodone, they develop constipation or orthostatic hypotension. That's not the problem. Tell them to get out of bed slowly. Tell them to take some fiber and drink. But to have respiratory depression is your priority. You want to prevent that because that's not good. So I'm not worried about you. A client with tearing chest pain to the back. This is rupture of thoracic aortic aneurysm. This is deadly. That is bleeding problem. They will bleed to death, which is in the B sharp. So bleeding will put the patient in shock. Therefore, I have to be sharp about this. A client on lactulose having full bowel movement. This require a little bit of content. So lactulose, okay, lactulose it is a laxative, okay? It's a laxative and it causes hypokalemia, and dehydration. So we titrate the dose based on the therapeutic value. The therapeutic indication, the therapeutic evidence of lactulose working is 2 to 3 bar movement. If you have more than 3 bar movement, we got to stop it because you become hypokalemic and dehydrated. Hypokalemic will be part of the B sharp, which is an cardiac problem. You give you hypokalemia, will lead to cardiac arrhythmias, and therefore you have to be sharp about it. So you prevent the patient from going into that situation, and therefore 4 bar movement is not good. I need to see that patient first. So this I intentionally did it. This is not one choice, there's multiple. So we have to see 4 patients. So we see 1, 2, 3 patients. So this is it. It's a summary of how you can answer question both pharmacologically. You see how they can ask you pharmacological question in both SATA and priority. You just have to synthesize everything, make things easier for yourself. Um, it's a content at the same time strategy to know what you're focusing on. You have to be sharp and you have to know how to ask your case and your buzzwords. And then you try to figure out what kind of rewrite you want to write, very short one, and use that to make a choice. And you move on. You don't evaluate each answer based on the other one. You just keep on moving on. Thank you for listening. Thank you for your time and good luck in your exams. And subscribe to the channel for more content and comment will be appreciated and so that we can improve on our content. Thank you and have a great day.